These antioxidants can reduce creatinine levels by up to 50%. Scientifically, this is the strongest antioxidant on Earth. In this video, we will discuss the antioxidants that will help rejuvenate your kidneys. Today, science is very clear about this. The higher the intake of antioxidants, the greater the chance of avoiding conditions like diabetes and high blood pressure. These conditions damage the kidneys through a process called oxidative stress, caused by free radicals. Free radicals harm parts of cells, such as DNA and cell membranes, by stealing electrons through a process called oxidation. We need to stop this process if we want to prevent kidney damage. The only thing I can say is, only antioxidants can do this. There are vitamins and molecules that we can use to address this issue. Some researchers have gone further and begun isolating specific vitamins and natural compounds with the strongest positive effects on kidney function. What they discovered is unbelievable. Some vitamins and natural substances can significantly slow down the blood filtration process. Specifically, according to a recent meta-analysis, certain antioxidant therapies could reduce creatinine levels in participants by an average of 1.10 mg per dl. A reduction of 1.1 mg in creatinine is actually an excellent result because it was observed across 10 studies spanning 5 decades and involving 1,979 participants with stage 3 to 5 kidney disease. These participants had kidney disease from a variety of causes, including diabetes, high blood pressure, nephritis, genetic conditions, and more. The simple fact is that their creatinine levels dropping by 1.10 mg per dl is remarkable. However, it's clear that some vitamins and molecules have stronger antioxidant properties than others. Specifically, as you can see, one of these antioxidant molecules was used in a study to achieve a significant reduction in creatinine levels, a 50% reduction. This means that someone in stage 5 could return to stage 3. Is this possible? We will dive deeper into this topic in this video. Before that, which vitamins have the strongest antioxidant activity in the kidneys? There is one vitamin that is truly your kidney's best friend. It is an extremely powerful natural antioxidant. I'm talking about vitamin C. Studies show that consuming more vitamin C can increase antioxidant levels in your blood by up to 30%, which is a very effective way to improve kidney function. This vitamin, when present in high enough concentrations, can neutralize free radical molecules that, if too abundant, can harm the cells inside the kidneys. This is one of the most common causes of kidney damage. As we have seen, vitamin C is also very important for iron absorption and preventing anemia. It also plays a crucial role in wound healing, bone and tooth formation, and cardiovascular health. There are also studies linking vitamin C with reduced blood pressure, so you really want to ensure that you are getting enough of this important vitamin every day. The most famous sources of vitamin C are citrus fruits, but you can also get vitamin C from strawberries, green and red peppers, broccoli, Brussels sprouts, and kiwi. However, in many cases, it may be better to supplement this vitamin as well. You don't want to supplement with more than 60 mg of ascorbic acid per day. Be cautious with this because most supplements are formulated with the general population's needs in mind, so they may contain up to 1,000 mg or even more of vitamin C in a single pill, and that could be harmful to the kidneys. Now, there is another vitamin with antioxidant properties that can reverse ESKD, a very powerful antioxidant. It is so effective that it has been used on 59 diabetic patients with stage 3 kidney disease to reverse the progression of the disease. I am talking about vitamin E. Vitamin E is not commonly recommended as a supplement for people with CKD because it is a fat-soluble vitamin, meaning that if taken in excessive amounts, it can accumulate. This is very dangerous for patients in the advanced stages of kidney disease. However, vitamin E is extremely powerful as an antioxidant. A recent meta-analysis carefully examined several placebo-controlled studies conducted on kidney disease patients and demonstrated that vitamin E can reduce signs of oxidative stress, reduce proteinuria, the most important marker of kidney damage, lower the risk of cardiovascular disease, the leading cause of death, and more. In another study conducted on 59 diabetic patients with stage 3 kidney disease, those who were supplemented with 400 milligrams of vitamin E had a significant reduction in creatinine levels and a substantial improvement in GFR. Although antioxidant therapy containing vitamin E can be extremely effective, as these studies show, I recommend supplementing with vitamin E only after being informed and consulting with a doctor. We should also consider that adding some of these vitamin-rich foods and other antioxidants to our diet can be very beneficial. Let's take a look at some antioxidant-rich foods that can make a difference for kidney health. Be sure to include pomegranates in your diet. This underrated fruit is great for health. It is packed with antioxidants, vitamins, and phytochemicals, so just eating a small amount daily can positively impact the health of those with kidney issues. In a recent study on kidney disease patients, blood pressure was reduced to the point where some patients were able to replace their blood pressure medication with pomegranate juice. When it comes to vitamin E, make sure to include sunflower seeds in your diet. This is a truly underrated food. Just 1 ounce of these seeds contains up to 66% of your daily value for vitamin E. Although sunflower seeds are beneficial, they should be consumed in moderation for patients in advanced stages because they are also high in phosphorus. Another food you can eat a lot of is red cabbage. All types of cabbage are excellent additions to a kidney-friendly diet because they are low in potassium and calories, and can be used in many healthy and tasty dishes. However, red cabbage is richer in antioxidants, making it even healthier. Don't forget about raspberries. These fruits should always be part of a kidney diet. They are too good for health and too low in harmful minerals to be overlooked, and raspberries are the best when it comes to antioxidant content. Also, don't forget about grapes, especially red grapes, which are packed with powerful antioxidants called anthocyanins, associated with blood pressure control, reducing damage to blood vessels, and protecting against heart disease. All these foods are strong protectors of the kidneys and are a great part of a long-term kidney-friendly diet. Remember, a diet rich in antioxidants is a diet rich in color. Now, there is an extremely powerful vitamin-like molecule for protecting the kidneys from oxidative damage. It is called Coenzyme Q10, CoQ10. CoQ10 is particularly interesting for those in stage 5 of kidney disease. It has actually been used in a large study conducted on dialysis patients, and the results were incredible. Among 21 dialysis patients who took CoQ10, 9 were able to stop dialysis in just 8 weeks. I will go deeper into how to use CoQ10 to protect the kidneys in my next video. Stay tuned and subscribe if you haven't, so you don't miss out. Now, it's time to look at the molecule that has been used to reduce creatinine by 50%. This is acetylcysteine, or NAC for short. NAC is one of the strongest antioxidants on Earth, with incredible kidney protective benefits. It is known as a powerful antioxidant, capable of scavenging free oxygen radicals in the body. Researchers have found a link between low levels of this antioxidant and many diseases, including kidney problems. Unfortunately, exposure to toxins, poor diet, chronic illness, infections, and stress can lower levels of this powerful antioxidant. Restoring these levels to normal can have a powerful kidney-repairing impact, according to studies. The good news is that NAC is now available as a remedy after a long period of controversy. There are also studies showing that NAC may be effective in lowering homocysteine levels, a risk factor for heart and kidney disease. These are a lot of benefits for a supplement with no side effects and that may lower your creatinine levels. Now, it's time to answer the question we all have in our minds: does NAC really reduce creatinine by 50%? NAC truly lowers your creatinine levels, there's no doubt about it. NAC is very effective at reducing creatinine levels to the point that it's often used to protect the kidneys from contrast-induced nephropathy. What is contrast-induced nephropathy? You know, if your doctor asks you to undergo an X-ray test with iodized contrast, your kidneys could suffer serious damage. This is called contrast-induced nephropathy, and it's a significant issue for those with kidney problems. But NAC is so powerful in protecting the kidneys from oxidative stress that it's commonly used in these tests to prevent this kind of damage, as it has been observed to prevent the rise in creatinine levels that we often see after these tests. However, this comes with its own issue. NAC has been seen as so powerful at preventing the rise in creatinine levels that some researchers began to question whether it is truly protecting the kidneys or simply lowering creatinine levels. Creatinine is a waste product that the body produces at a constant rate, which is why it is used to measure kidney function. When creatinine is no longer being excreted at the proper rate, we know there's a problem. But simply reducing it could mean two things: 1, the kidneys are functioning better, or 2, something is artificially altering the creatinine levels. Researchers wanted to know which of these two things was happening, so they decided to conduct a test to rule out a potential confounding interaction. NAC was added to a patient's plasma sample in an experiment, and the serum creatinine level was measured. They did not observe a reduction in creatinine levels. They also administered NAC to a living organism, this time at very high concentrations. What they observed was incredible, a 50% reduction in creatinine levels. Thanks to this study, we know that NAC can quickly and effectively reduce creatinine levels. Although you may not see a 50% reduction in your creatinine levels when using NAC, it can be used effectively over the long term to prevent oxidative damage to the kidneys. If NAC is so powerful, why isn't it used more widely? It's worth noting that NAC has not been available for sale in the US for a long time due to regulatory issues. However, recently, the FDA clarified its stance on NAC, and now supplement brands can sell this powerful remedy in the US. This is great because it means more people will be able to use this highly effective treatment. These 5 superfoods have been proven to reduce creatinine levels and enhance kidney health. Incorporate them into your diet to lower creatinine and improve your kidney function. When optimal kidney health is your goal, there's no better approach than paying close attention to your diet. We will explore some simple yet effective ways to naturally lower creatinine levels, primarily by improving your kidney function. If you want to manage high creatinine levels, addressing the underlying causes is absolutely essential. While we live in a culture that often leans heavily on medications, when it comes to the overall health of your body, it's undeniable that food remains the best medicine. Many people say healthy eating should be common sense, yet numerous superfoods continue to be overlooked and underrated. In the next few minutes, we'll make sure you're not one of those who miss out. First, we should understand why reducing creatinine should not be the main goal for individuals with kidney problems. So, what is creatinine, and why is its level considered important? Creatinine is a waste product. The body produces it through muscle metabolism, and everyone has a certain amount. When your kidneys are functioning properly, they are capable of filtering and eliminating enough creatinine from the body. Currently, people with kidney disease or impaired kidney function have been observed to have higher creatinine levels, especially in stages 3, 4, and 5 of the disease. In short, creatinine levels increase when the kidney's ability to filter waste from the blood declines, making creatinine a good indicator of kidney function. This is why creatinine levels are always monitored in routine blood tests. What can you do to lower your creatinine levels and improve your kidney health? Your kidney health is directly related to what you eat every day and how you take care of your body. Your daily habits, stress levels, sleep quality, environment, level of physical activity or inactivity, and overall quality of life are all factors in the equation of your overall health. Diet also plays a crucial role. In fact, it may be the most important factor. Therefore, for those looking to lower their creatinine levels through proper eating habits, one of the healthiest solutions is to include green vegetables that are low in potassium, phosphorus, and sodium. That's why I've compiled a list of 5 superfoods packed with antioxidants, vitamins, and many micronutrients. Add them to your diet to see quick and lasting improvements in your kidney health and a reduction in creatinine levels. Number 5. Organic corn on the cob. Corn is often considered an unhealthy food by many. This is mainly due to its distant relatives, cornmeal and corn syrup, which are processed and unnatural foods. A large amount of processed food and industrial corn is consumed daily. However, very few people are aware of the health benefits of eating fresh organic corn. Raw, uncooked corn is low in calories and potassium but rich in fiber, phytochemicals, and folic acid. It is a good source of vitamins A, B, and E because these vitamins are more easily absorbed from corn than from green vegetables like spinach or broccoli. These antioxidants play an important role in preventing many chronic diseases, including chronic kidney disease, CKD, and various types of cancer. Number 4. Lemon water. Perhaps the best way to add lemon water to your kidney-friendly diet is by drinking it in the morning with a glass of warm purified water. This way, lemon water will awaken your kidneys and liver to flush out toxins, support weight loss, stimulate digestion, and help regulate creatinine levels. The acidity of lemon water has been observed to help prevent and break down kidney stone formation. Number 3. Berries. While raspberries, strawberries, and blueberries are rich in antioxidants and offer many benefits in combating high creatinine levels, the best berry for our purpose is the cranberry. Cranberries are particularly beneficial in supporting kidney function and the entire urinary tract. They can increase the natural acidity of urine and prevent bacteria from adhering to the walls of the bladder. This helps prevent bacterial infections in the urinary tract and bladder, making cranberries an essential part of a well-planned kidney diet. Although they can be eaten fresh, cranberries are most commonly available in juice form. Number 2. Cabbage. Cabbage is considered one of the healthiest foods in our diet for many reasons. First, it is low in potassium, making it ideal for a kidney-friendly diet. It is rich in fiber, folic acid, and vitamins C, K, and B6. It is also full of phytochemicals, compounds that have shown the ability to fight free radicals. Cabbage is especially high in sulforaphane, a phytochemical that may slow the growth of various cancers, including kidney cancer. Although cabbage appears in many recipes, to get the most out of it, you should try eating it raw. In fact, cooking it can reduce its nutritional value. Cabbage is one of the superfoods you should eat daily, even if you're perfectly healthy. Number 1. Red bell peppers. This superfood is considered by many experts to be the best thing you can add to your diet. And they might be right. Raw red bell peppers are not only delicious on their own or in salads, but they also contain many of the nutrients your body needs. They are particularly high in vitamin C. Just one medium-sized red bell pepper is enough to meet more than the recommended daily intake of this essential micronutrient. They are also low in potassium, making them a great choice for kidney patients. Raw bell peppers are an excellent source of lycopene, a phytochemical linked to the prevention of kidney disease, cardiovascular disease, and prostate cancer. They are also rich in vitamin A, B6, and folic acid. Bell peppers come in various colors, from green, unripe, to yellow, moderately ripe, to red, fully ripe, with red providing the highest amount of valuable nutrients. This doesn't mean you can't eat yellow peppers or that you can't cook them. That's all for today. If you liked this video, please like and subscribe to the channel. Thank you for watching.